And it's time now for Patel It Like It Is, where Dr. Alok Patel shares health advice on the topics that matter most to you. Today, we're talking about a surge of respiratory illnesses in China. The flu, RSV, and other infections have been sweeping across some parts of the country as China experiences its first full winter since easing COVID-19 restrictions. Here's Dr. Patel with what you need to know.
If you hear possible mystery respiratory illness, you might get a flashback to 4 years ago, before the world knew COVID-19. So when headlines talk about a rise in respiratory illnesses in children in China, people have questions. Here's an overview of what we know. In October, the World Health Organization began monitoring data showing this trend from Chinese surveillance systems. In mid-November, Chinese officials attributed the cases to lifted restrictions and viruses that come with the season. Now the World Health Organization says that the causes are mycoplasma, a common cause of pneumonia, RSV, adenovirus, and influenza, and not any new or unusual bacteria or viruses.
That's a relief.
It is, but there's still a lot of respiratory disease out there. When restrictions are lifted and kids are back to being kids, and there's increased surveillance, like in northern China, this isn't that surprising. This is similar to what happened in the United States last year. Remember all those warnings about the triple-demic? And maybe now we're just all on heightened alert, and that's not a bad thing. It's important to pay attention to keep you and your loved ones protected. Now pay attention to this. 10 states, including New York City and Puerto Rico, are experiencing high or very high levels of respiratory illness activity. So make sure you get all your vaccines if you haven't already, and if you have any cold symptoms, please stay home. Don't spread it to others.
If your kids are sick, be sure to keep them home and not in school. And I know this can be kind of inconvenient because these adorable little creatures seem like they get sick often, but it's a really good move for public health, so please and thank you. Alora, show America how you cough in your elbow. Good job.
Your assistant is the best. Dr. Alok Patel joins me now for more. So what's happening in China? Is this just to be expected after lifting COVID restrictions, or is there cause for concern here?
You know, it certainly isn't that surprising based on what is happening when you have this first full winter with all those viruses since lifting restrictions, which China did earlier this year. And Diane, people may see this reminiscent as what happened here domestically about a year ago when we had this large early influx of cases in children with RSV, influenza, and other viruses, with some public health experts attributing to what they call an immunity gap. I understand the cause for concern because previous epidemics from flu strains, SARS, COVID-19, all started out with mystery cases of pneumonia. But now that the World Health Organization has actually seen lab and epidemiologic data and has confirmed that this is most likely related to RSV, adenovirus, influenza, and mycoplasma, people should be able to breathe a little sigh of relief because there is no unusual or creepy strain out there.
All right. I think most of us have heard of some of the other things you mentioned, like RSV, adenovirus, but can you talk more about mycoplasma? What is it and what are the signs?
My phone has been blowing up, Diane, with people asking about this because people are like, oh my gosh, what is mycoplasma? Now, mycoplasma is not the notorious celebrity as some of the other respiratory viruses because oftentimes it causes a mild cold and people never actually get tested or even need to see medical care. But according to the CDC, there's about 2 million cases a year. Usually in kids, this presents as something we call tracheobronchitis, which is a fancy word for chest cold. So think sore throat, cough, maybe feeling a run down. Now, sometimes mycoplasma can progress into pneumonia. And signs to watch out for that would include fever, chills, coughing, and shortness of breath. Now, oftentimes in doctor lingo, we call this atypical pneumonia or walking pneumonia because people seem fine. But if you have any of these symptoms and they're lingering for a long period of time, you may want to see a doctor to make sure that it's nothing more serious, and you may need antibiotics.
And what about the flu shot? How effective is it this year, and when should we get it?
Well, if you haven't gotten it already, do so right now. In fact, get your flu shot, your COVID-19 booster, your RSV if you're eligible. It takes about 2 weeks to get full protection. You want to get that done before all the holiday shenanigans. Now, in terms of effectiveness, we don't have data for this year, but here's an important finding from last year. Last year, we had one of the worst flu seasons in kids since 2019 H1N1, with about 50,000 kids getting hospitalized. But recent data from the CDC shows that flu vaccine cut the risk of kids needing medical interventions in the ER, urgent care, or getting hospitalized by about 50%. That's big. And even if you get the flu after getting the flu shot, you are much less likely to wind up in the ER. I compare it to seatbelts. Yes, you might be able to drive without a seatbelt and be fine, but guess what? If you wear one, you are much less likely to be in a bad situation needing to go to the ER. So get your shots.
All right, Dr. Patel, thank you. And remember, Dr. Patel is here to take your questions, too, so just leave a message on our Instagram feed at ABC News Live, and he might answer your question right here on Friday.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.